This is Lindsay Morgan. I am doing my head to toe assessment. I do not have any kids or anything that I can do my assessment on, so this is Mr. Schwartz, and this will be the best that I can do for right now. So I'm going to gather my supplies, check my chart. I'm going to wash my hands before entering the room. And hi there, Mr. Schwartz. My name is Lindsay. I'm going to be your nurse today. How are you? Perfect. If you could please tell me your first and last name as well as your date of birth. Perfect. Thanks so much. And do you know where you are today? Yep, you're correct. We are in the hospital. At this time, Mr. Schwartz, are you experiencing any pain or discomfort? Okay, perfect. So I'm going to do a quick head to toe assessment for you, and we're just going to make sure that everything's looking good. I did already have my tech check all my vitals. Everything is looking normal there. So I'm going to start with the neuro. I have already checked the orientation of my patient, asking, who he is, where he is, that kind of thing. So Mr. Schwartz, I'm going to start by checking your eyes here. If you could just look straight ahead for me. I'm going to check, make sure pupils are equally reactive. Perfect. All that's looking good. If you could say ah for me. Great. And all the mucous membranes do look well lubricated, so we're not too dry there. All right. And if you could, we're going to check your extremities here. If you could move your arms up for me, above your head. Perfect. And if you could wiggle your toes and your legs for me. Perfect. And then just squeeze for me. Great. So while I'm doing this, I'm also going to be taking a look at their skin and making sure I don't see any wounds, lesions, or swelling of any sort. While I'm here, I'm also going to check cap refill. So it looks like the blood is returning to his fingers in about 2 or 3 seconds. And then I'm also going to check skin turgor. And we're also looking good with that as well. Was there any pain with any of that, Mr. Schwartz? Good, good, good. So moving right along, I'm going to check his radial pulses. I'm going to do both sides. Perfect. And then also the pedal pulses on both sides. Very nice. And then as I could on the patient, I would check, the bony prominences, where his heels are. And when I lay him forward to listen to his lung sounds, and I would check on the back as well, also checking the skin, making sure that it is warm throughout and that we have no severe dryness or severe moisture or signs of edema or anything. So I'm going to move on to checking the lungs. Mr. Schwartz, if you could just sit forward for me. Perfect. And I'm going to listen on both sides of the back, just going back and forth as such. Making sure that I hear no signs of crackles, meaning there would be no fluid or anything in the lungs. And if there was any coughing, I would listen to that. Also, are you experiencing any trouble breathing or any coughing? No? Perfect. So I'm going to have you lean back for me, Mr. Schwartz, and I'm going to listen to the front for breast sounds as well as the heart sounds. And I'm going to want to listen up right here as well as at the apex here. And again, I'm listening to make sure that there is no crackles or anything of the sort. Do you have any issues breathing right now? No? Any pain or discomfort? Perfect. So we're going to look at the abdomen. We're going to start in the right upper quadrant. And I'm going to keep it here for a couple seconds to make sure that I hear normal bowel sounds. Moving over to the left upper quadrant. Going down to the left lower. And across to the right lower. Perfect. And then I'm going to palpate as well. And is there any pain or discomfort? No. Okay. I'm also going to want to make sure that I'm checking the skin here. Make sure I'm not seeing any bruising or anything around the belly button, around that section. All right. Perfect. And then have you had any bowel issues in the last couple days? Perfect. And when was the last time that you had a bowel movement? This morning. Okay. And were there any issues urinating at this time or anything? Okay. And what was the color of your urination? Perfect. So it was yellow. So we're not seeing any signs of red or anything of the sort with my patient. So that looks good. And then Mr. Schwartz, did you have a family member with you here today? Perfect. And are you going home with that family member, or are we going to a care facility? You're going home with him. Okay. So while I'm doing my head-to-toe assessment, I'm also going to be assessing, with their musculoskeletal, I would have him in real life maybe swing his legs around and kick his legs and check reflexes that way, just to see if he needed to be put on any safety precautions or if things are good with that. So I am just going to return the bed to the lowest position. Mr. Schwartz, I do have a call light here. If you were to need anything, feel free to call. And do you have any questions for me at this moment? Perfect. Okay, thank you so much. I'll be in to check on you here in about 15 to 30 minutes.